Hello and welcome to Back to Health YouTube channel. We're going to be talking today about stabilizing the shoulder, and I'm just going to let you in on a few secrets of the shoulder here at Back to Health. And I want to cover for our patients the use of a kettlebell, but again could be a barbell or something slightly heavy that creates a compressive force in the shoulder when you lay on your back. And we're going to go through one of the best ways to treat both shoulder and neck. You'll never hear me talk about just one joint. It just doesn't seem to work that way. But the muscles of the neck should work by themselves without firing the muscles of the shoulder. Makes sense, right? Because then your shoulders get a rest when your neck's working. And the muscles of your shoulder should work when you fire your shoulder, but again, not your neck. So we want what's called autonomous motion with the neck and shoulder. And so we want to program your brain to use your shoulder muscles when you use your shoulder and your neck muscles when you use your neck. So how do we do that? Well, we're going to show you a little trick. This is an awesome workout. Again, I've got to say in our segment for thoracic spine mobility, in many of our segments, I'll always start with proper breathing. Take a deep breath. If you see your shoulders move, you're doing it wrong. It needs to be reprogrammed. We need to get your brain and your respiratory system working right before we exercise. So if you go for any kind of a long walk or run, why not get your breathing right so that you're not using your neck muscles to breathe and shoulder muscles to breathe. So that's going to be counterproductive for what we're doing. So I want you to think about getting your breathing right. One of my favorite exercises is crocodile breathing. And we have a segment on crocodile breathing with thoracic spine mobility. But basically, you'll put your stomach on the ground, forehead on your hands, take a deep breath, all the way in, all the way out. And you should see your low back raise off the ground. And you'll want to do that for a few minutes. I say 3 to 4 minutes. Once you get it right, it could take up to a minute before you stop having your upper back raise off the ground. So we want to get that programmed right and before we ever treat a shoulder. Now, I'll also say there should be no pain when we do any of these exercises. But you're going to lay on your back. I like a kettlebell because it lets the weight hang directly down the back of my arm as opposed to some of the weight out here and out here with a barbell. But we're going to just lay on our back and we're going to rotate in as far as we can at the shoulder and then out as far as we can at the shoulder. We're going to do that 10 times. Here we go. Here's 3, 4, 5, 6, 7, 8, 9, and 10. Now, I've done that 10 times. And so now what I'm going to do is I'm going to rotate it in and lock it in and hold it in. Now I'm going to rotate my head only 10 times with the kettlebell in. There's 2, 3, 4, 5, 6, 7, 8, 9, 10. Now I'm going to rotate my shoulder out and do the same thing 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now I'm done with the 90-degree section. Now, so you can see me, I think I'll just pretend that I was doing this on my right side, if that's okay. I don't recommend you switch barbells right above your head very often, but here we go. So I just finished on this side. I'm going to go up now. I'm going to change this 90 degrees to a slightly different degree. So this is actually a stage of the Turkish get-up. And I'm going to get into this position, and I'm going to do the same thing again now. 2, 3, 4, 5, 6, 7, 8, 9, and 10. So I started here at 90. Now I'm here doing the same thing. I just did 10. I'm going to go up and back now 10 times. Actually, I'm just rotating my head. And I forgot to say, I'm rotated out as far as I can. You can start in or out. You can do both ways. I'm rotating my shoulder in, locking it. I'm going to go 10, 6, 7, 8, 9, 10. Now I'm going to hold the arm out. 1, 2. You'll find that this is an amazing workout. You may have to take a little break between positions. That's not unusual. It's a little like holding a medicine ball above your head, so hang in there. And 8, and 9. And the tendency here is to forget that I need to be rotated out or in, but I am staying in that position. I'm going to change my position now to where I'm sitting, and I've got another angle of compression going on in my shoulder, and I'm going to do 10. Now the first time you do this, another thing you could do, you notice I'm counting 1 with each in and out. You could just go 1, 2, 3, 4, 5, 6. Makes it a little easier for you if you haven't done this. And we're not big on numbers here. We just want you to do things right and enough that it works. And we'll find that's plenty to do 5 full sets or 10 if you count each one. So we'll do this. Now I'm rotated all the way in. If you can't see, I'm starting with in. 7, 8, 9, 10. Now I'm going to rotate out. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And now, done. So once you're done with that, your patients are pretty amazed. You know, you get up and you go, oh my gosh, my shoulder and neck feels so loose. And you'll have this relaxation going on in the shoulder when you're using your neck, and it improves the range of motion. It's a phenomenal exercise. We call it the kettlebell exercise for shoulder, and it's a great one. Now, next one for shoulder, very important, is when we sit, we tend to rock or let our muscles contract in the front. That creates a condition we call upper cross syndrome, where these muscles right here become contracted. And so the opposite muscles back here try to actually correct that. And again, this is not a wiring fault. This is actually your brain saying you need to be in a better position. So when you're sitting there texting, working on a computer, mousing, etc., writing a check, whatever it is you're doing forward flex, the muscles on the lower part of your scapula, called the infraspinatus or infraspinatus muscles, those guys are working overtime to try to bring your shoulders back. And they develop trigger points and become ineffective. And so we want to work those trigger points in that infraspinatus, untangle them, stretch them, and then we actually want to start to engage them again, just like we do with the gluteal muscle when somebody sits a lot, and we'll see that in our Secrets of the Hip and Knee module that we have available on YouTube as well. So the good way to work the infraspinatus muscle is very difficult. So this is one where, you know, a massage therapist, physical therapist, chiropractor, athletic trainer, someone who can really work with those soft tissues could be a great help. But you still can use the baseball or a ball to get into this infraspinatus muscle. Most of us can just kind of reach back in there, or some of us I should say. Others may need a wall. And you'll know where this is because it's not going to feel very good when you get on it. And you just go back and forth once you're on that muscle about 20 times, just enough to loosen it. And you'll know because it's, you know, if you feel your scapula, the top of your scapula, if you go down about 3 inches to 4 inches, you'll be on a muscle that's real tender in that area. And you want to just work that out for about 20 repetitions, 10 seconds. It'll try to slip if you use a wall, but that's okay. If it does, just pick it up and start again. So we're going to loosen that up first. We've talked about some great stretches to do for the thoracic spine, but you can just stretch that muscle a little bit. I really like it. This stretch is one of my favorite stretches. Sit in a chair like this. Try to bring your arm behind you, and then reach around and try to grab that elbow. If you can do this, it's a wonderful stretch for those muscles of the back of the shoulder. It's really good. And hold that for about 15 seconds just to loosen it. You're going to find the sweet spot there. I just rotated my spine to kind of lock it in a little more. You kind of learn some different things to make yourself have a little better stretch. We're all slightly different. And I get a good stretch in there. Now that I've loosened that muscle up, I'm going to actually fire it. And I need to learn how to fire it again because I've been sitting like this and it got all tight and then it kind of quit. Pooped out. So we're going to go down like this. I like to use whatever you have available. It could be a notebook. I'm going to use what I just grabbed right there. And we're going to get down on our hands and knees, and I'm going to go out at 45 degrees with my head down and try to touch that stool, which I'm doing. The first step here is just to reach and try to fire that muscle. And so we're going to come out as far as I can go, 45 or so degrees. And I can't go much further right now, but if I come back and relax, then go back out, I can probably go even a little further. I'm going to try it even one more time. Let's see if I can beat my record. Nope, that's it. I'm going to rotate my hand up as far as I can, and I'm going to do that 10 times, just like that. My thumb should go to about 2 o'clock. I think I'm at 12 o'clock right now. So I'm going to go to 1, then 2. If I can't go any further, go as far as you can go, and then back down. So it's going to be palm down, palm up 10 times. 4, 5, 6, 7, 8, 9, and 10. If you can do it, and it's not important that you can lift your arm, we want you to try. If you just want to start getting your brain talking to that muscle. And this is the best, if not only way I know of, to actually isolate the infraspinatus muscle that needs to be switched on to hold your shoulders right. So you turn your palm up and then attempt to keep your arm straight and lift. 1, 2, 3. You see that I can barely get off the ground. This is pretty typical. 4. It's only important that I'm firing that muscle though. So if I'm doing this, 6, 7. Trust me, I'm firing it. 8, 9. That's okay. If you have the luxury of having a band that you can use, you have a nice little door that you can put a band in from an angle like this. You can actually, could be my door, hold that right there. You can actually go down, and I'll just demonstrate this, like this. Come down, rotate that guy up, and have the band help you bring your arm up 10 times. And you're still going to be firing, but you're also going to be teaching your brain that movement so that it does get better at doing it. And if you do these regularly, you'll find that your neck and shoulders feel so much better because they're just naturally being held in their proper position, and they can quit contracting and trying to correct for the poor position, which is what they'll do. It's just the way we work. So that concludes Secrets of the Shoulder here at Back to Health. We talked about mobility, how it ties in with the thoracic spine mobility, so watch that module. It's a precursor. We talked about how to warm up the neurology using the kettlebells to get singular movement with the neck muscles and the shoulder. We also discussed and showed and demonstrated how to get those shoulders naturally being held back the way they should be. So that concludes our shoulder module. Thanks.